So where are you from?
I'm from Illinois, just not too far from the capital. I've been suffering with TMJ for years and have seen multiple doctors, physical therapists, chiropractors, and I reached a spot where my pain has not been alleviated, so I started searching on the internet and found you.
So you've seen 4 TMJ dentists, and
Yes.
what kind of treatments do they do for you? What do they make?
I have had bite equilibration, grinding, selective grinding on my teeth, and I've worn a splint to some extent ever since 1982.
Has it helped?
Yeah, the first splint was like a miracle.
Yeah.
2 days after he put it in, the headaches were remarkably better. I literally wore through it in 9 months. And at that time was given the option of a permanent splint or orthodontics.
Gotcha.
I chose orthodontics and have never had the level of pain relief since.
Probably because things broke down in the back more and more over the years.
There's a place here that feels like there's something poking. The neck and shoulder pain around the back, the occipital back here, and the muscles in my face ache all the time.
Do you have pain on the top of your head, on the side of your head?
I've got spots all over my head that seem to hurt. Now, I was told that they are trigger point muscles, a lot of them,
Okay.
and sometimes it even hurts to wash my hair.
How about the neck? Do you have any stiffness there?
Yes.
Is it tough to back a car?
Yes.
Do you ever stick your tongue between your teeth?
Yes.
Do you ever get tightness underneath your lower jaw?
Yes.
Big time?
Yeah.
Does it ever lock, like spasm?
Yeah, almost to the point where I almost can't swallow.
Right.
Yeah.
How sensitive are your teeth to cold?
Very sensitive.
Has that been something you remember for a long time?
To a small extent, but it has gotten worse, and the last time I had my teeth cleaned, she usually would put on the fluoride before she'd start cleaning, and that helped a lot. But back in October, my last teeth cleaning, it wasn't bothering me so much,
Sure.
so I didn't think to mention it, and now it's horrible.
It was bad.
Yeah, bad.
Not fun.
Okay.
0 to 10.
That is just about a 9.5.
Pretty bad, huh?
Oh my God.
It lingers.
For a little bit,
Now it's gone.
and now it's gone.
Can you chew gum?
I don't chew gum.
How about steak?
I suffer through steak.
How about salad?
I suffer through salad. I probably eat what I'm not supposed to. I've been told many things to quit. I was told to quit singing. Every year, whenever we start playing, I think, is this going to be the last year?
Oh my, that's no fun. There's your ear, your jawbone, the condyle, there it is right there. And there's your disc,
Right up there.
torn way out. See that?
Yeah.
That little squiggle S,
Yes.
he's all shriveled up. Remember I told you
Yeah.
yesterday if he was pulled forwards, he'd be like almost like an old rose that's kind of
Yeah.
dried up and shriveled up.
There it is.
Or a prune. Yeah, there it is, right there.
This is the right side,
Yes.
which is why my right side very rarely pops.
Yes, and this is a 9 o'clock disc that's locked. I would assume locked. We'll check when we have you open. But here's the top of your condylar head. It's not sitting up here like it's supposed
Like
to be.
that's where it's supposed to be.
Yeah, and right in front of the S, look at that little white thing. That's a sign of inflammation. Well, duh, it's like you've got a splinter stuck in your bicep for years, and it's swollen a little bit, right? So that's what we're looking for with on the right side. So it's definitely displaced. So she's 9 o'clock right side.
Okay.
Now the lateral aspect and the medial, she's completely out on the right side.
Okay.
Let's look at the left side. Look for fluid in here now. We're on the left side. And there's your disc out there too.
Mhm.
It wasn't focusing, so I just stopped putting this.
So that's the disc right there.
That's the disc. The disc is right here,
And
and the
it's supposed-
fluid is right above it. Okay, so so we've got some inflammation, but our bone seems to be alive. Okay, so that sucks and that's good. We got one thumbs down, we got one thumbs up. I'd rather have a thumbs up on the live bone than, if you're going to have a problem, I'd rather it be inflammation. Okay. And I'm not a surgeon, so I'm not some big expert, but I know enough. I think if I add to the bottom and the top, when you're chewing around, you get off your back teeth, it will remove, theoretically, the masticatory muscle pain layer resultant of being on my back teeth all the time. Because remember, it's all about time.
Yeah.
When you get off your back teeth rapidly and back onto your front circuit, U-shaped jaw, front circuit, back circuit. I want to get off my back circuit, back teeth, in 0.5 seconds or less when I chew sideways. That's what we do. It sounds easy, it's not so easy, but my point is, if I can prove definitively and objectively that you're off your back teeth in half a second or less, per Kirstein's theories and per the stuff that I've been adding to with his theories, and I know it works.
Yeah.
You know, now, it may not be your only layer of pain. It might be only 2% of your pain. It might be 50%. It might be 10. We don't know till we do it.
Right. The video that I watched that was the most compelling about me coming down here was the guy that watched a grown man cry.
Yeah.
And, you know, he said for 20 years he'd been like that, and then it, like, he can feel it releasing. I can't imagine what that would be like.
Yeah. We see that she's seen it. She had it herself. She had it done about 3 weeks ago. She felt it.
That letting go.
Yeah, I would have to tell myself to stop clenching my teeth and like let out.
Yeah, but see, she's got normal discs.
Yeah.
Yeah.
See, the patient that's the slam dunk, the upper thirds in our practice, in most practices be 80 or 90%. But in our practice, we see crazy hard stuff, right?
I'll bet.
Yeah, so yours is not that bad, by the way. You should see bad. If they come in with great discs, like the last video I posted, the blonde girl, she happens to be my hygienist.
Really?
And it's not a fakey thing. She's my assistant. It's not fake.
No, it's
Barb and her, they've been watching me do this since they came on with us a few months ago because we just moved the office down here. And they finally piped up and said, I've got that problem. Because it's really common.
Yeah.
So Felicia, we didn't image, but Barb we imaged. Because her, I figured she was fine. She had no history of wreck, no nothing, no popping and clicking to speak of. But Barb had a semi-hitter, my hygienist. The one you met yesterday?
Yeah.
The blonde?
Mm-hmm.
Well, if you watch her video, it's the most recent one. I had to shoot imaging on her to rule out a disc problem, structure,
Yeah.
back here. And she was 1 o'clock, both sides. Good bone, no inflammation, normal size condylar heads. And she was convinced it was the car wreck. Because right about that time, that's when she started having headaches and sensitive teeth. Her front teeth started moving, they were a little loose.
My.
Beautiful girl, no gum disease, right? Well, it's muscle. Because what she didn't realize, just because it was a coincidence with a wreck, about 7 or 8 years back, they had moved her teeth orthodontically with Invisalign.
Uh-huh.
And they all orthodontists just about across the board on most of the planet, they don't measure their end result. In other words, they only take as paper to it if you're lucky,
Yeah.
right?
Yeah.
And that's very subjective. So they didn't measure her end result, and it was a coinky-dink.
It
So-
just happened about the same time.
Or maybe it pushed her because she's getting older, who knows, you know. Maybe her threshold was lower after the wreck, maybe it weakened something. Maybe it tore a little bit of the ligaments, but it didn't tear the disc out, because ligaments hold the disc on top of the bone. Who knows, but the point is we did it, and it's been 3 weeks now, and she hasn't had a headache. She had them daily. You know, her teeth was 10 out of 10 on the swish. She's a 1 out of 10 now, 3 weeks later.
That's amazing.
Still.
Yeah.
She released, she was yawning in the chair. I mean, yeah. So those are the top thirds.
Yeah.
Those are the easy ones. When I get this and I see 1 o'clock, grid fat and no fluid, bam. When I get this and I see, oh crap, 9 o'clock, retrodiscal tissue, 10 o'clock, the patient needs to know that the ultimate option, economics and fear aside, is you get the structure fixed.
Yeah.
You go to, so here's your option. I can do my thing today, you know, but you understand this is not a curative.
Yeah.
It will theoretically relieve a portion of the problem, but it's not definitive. You need to go to one of the TM oral surgeons that we use. One's in Maryland, one's in Florida.
I think Dr. Mark had mentioned the one in Florida.
Yeah, Piper. Piper is probably the world's best, and I've trained under him. I know him. He's one of my Yodas. He's a good guy. He knows his stuff. He's at the absolute bottom of the funnel. He gets the worst of the worst. Yours is not the worst of the worst. But my point is, the ideal world, fear and economics aside and time aside, you get the structure fixed.
Well, that should logically be first.
That's my point.
Yeah.
So if you're like, there's no way I can do that or want to do that now, then I do this, and you will have tried. Theoretically, it's better than probably most any splint, because when you bite down, this is called maxillary cuspation, like bite. Okay, that's your home. Let's call it home. Okay? Now theoretically, a splint could be built that pulls your jaw forwards. Remember on one side, when you were forwards,
Yes.
there was cartilage between it, but on the other side there isn't. So no splint on this planet is going to get cartilage between your bones
No.
on your right side. So the worst joint always dictates bite position. So there's no bite that you can have where you've got cartilage back because it's completely tore out on the right side all the way. Well, here's the good news. In your home, even though you're on retrodiscal tissue on both sides, especially the right, very little cartilage on the left, you don't have any, you have a little bit of inflammation, but your bone is still alive. So you've been functioning for 30 years in this habitual closure home bite position, MIP, whatever you want to call it. Theoretically, if I can get, as long as the bite isn't changing actively, like that's why I asked you first thing yesterday. Remember the way your teeth were separated?
Yeah.
I said, it's been like this for years, and you said yes. So it's not like it's changing like month by month.
No.
Yeah, that'd be a bad sign. If it was changing month by month, the MRI would probably show me blackness on T1. It would show me dying bone, and the bone itself was probably breaking down. That's why that happens to people.
Oh.
That is not a case I would even offer the DTR to. Yours is the bottom of where I would offer it, with the full understanding on your end that this is not definitive. This might be a little bit of a pain reliever. The good news is, as I said in summary, in your home, even though you don't have cartilage there, you seem to be relatively stable. You've got inflammation there though. That's kind of a little unstable, but the bone is still good. Okay?
Yeah.
So that's the bottom line. So if we do this today, I'm going to bond 4 canines, and then I'm going to adjust back teeth to make sure that you're off your back teeth in half a second or less.
Okay.
That's the bottom line. So do you want to do, or do
Yes.
you want to not? You want to go to Piper or Ziva?
No.
No? Okay. Break and open. Good. That was your right side. That was excellent. Now we're going to go home and we're going to go to the left side.
Okay.
And then open, okay? We're going to clench for a good second or so.
Okay.
Don't close yet. Bite home hard. Rake and open. Perfect. Excellent job. Okay, so it's been, what, about an hour and a half, 2 hours. How do you feel?
I feel better. My neck and shoulders I could actually, they don't feel like they're high.
Yeah.
They've calmed down, had a few snoozes. I was able to take a,
You had a cracked molar. We had to put a crown on, so you're numb on your upper left.
yeah,
But while you were waiting, you were
I was.
in La La Land.
I was, yeah.
So that was a good relaxed sleep? Or it
Yes,
was a,
yeah, because I feel like I'm always tense.
Yeah.
Somewhere, everywhere, always
And right
tense.
now?
And my neck and shoulders feel better. The face is still a little, but it's gone through a lot of work today.
Oh yeah, you've
So-
been here all morning.
Yeah, so I'm
Maybe
hoping
after-
that given a little bit of time to rest, that it'll be better. I'm sure it couldn't have hurt.
Any advice for the doctors? The doctors.
The doctors, yeah. There's got to be more patients out there like me than just me. I would like them to examine this method, and I would like to see it more widespread.
Yeah. Why travel so far?
The traveling isn't even knowing about it. You have to know about it to even find you.
Yeah.
And over the course of the last 34 years, I've done lots of research on TMJ and seen lots of doctors. And until you know about a treatment,
Yeah.
you're not informed.
Yeah.
And unless you're informed, you don't know what to do.
Yeah.
So this just needs to be looked at by the hierarchy, I guess, of dentistry,
Sure.
to where it's not something that somebody has to go searching for, a layperson. it's something that a doctor who treats TMJ should know about.
Right. And you understand and accept the fact that your joints are damaged.
Yes.
But you see, instead of us crossing our fingers with a splint, seeing if it changes, we went in there and we imaged you. An
Yeah.
hour later, we have MRI data that we know how to interpret and CT data that tells us if you're stable and adapted or
Yeah.
not. And you get that. I mean,
Yes.
The hinges are damaged. We explained that you were young when it happened, and and it makes sense.
Yeah.
And you can even recall the accident, right?
Oh, yeah.
Second grade.
Second grade.
And he tripped you in the hallway? Some kid?
Tripped me in a marble floor. I went down and busted my mouth.
Did it knock you out?
Nope, didn't knock me out, but they took me to a dentist and did some grinding off because it broke.
Your front teeth a little
Yeah,
bit.
mm-hmm.
Nice. What advice do you have for the patients?
Don't wait too long. I think the earlier you get working on this stuff, the way better it's got to be.
Yeah, for sure.
I mean, this has been a chronic thing for me for a long time.
Yeah.
And sometimes you get used to the pain and you learn to deal with it and you learn to adapt. But then it'll eventually get to where you can't
Yeah.
cope.